And in my opinion, the best thing for patients would be like, you know what? They said, here's what I should do based on whatever it is, imaging, my pathology, etc. You know what? Thank you so much. Smile and nod. I'm going to go home and think about it. And then I'm going to come back and say, I choose to do this. Now, why do I feel like that's important for people? I think it's important for people because it gives them a sense of power.
I'm Dr. Tina Kaczor, and as Leah likes to say, I'm the sciencey one.
And I'm Dr. Leah Sherman, and I'm the Cancer Insider.
And we're two naturopathic doctors who practice integrative cancer care.
But we're not your doctors.
This is for education, entertainment, and informational purposes only.
Do not apply any of this information without first speaking to your doctor.
The views and opinions expressed on this podcast by the hosts and their guests are solely their own.
Welcome to the Cancer Pod. Tina sat down with Dr. Holly Lucille, an acclaimed naturopathic doctor, author, and integrative medicine expert who you may have seen on national TV shows or listened to as the host of the Mindful Medicine podcast. Dr. Lucille breaks down the art of self-advocacy and shows you exactly how to become an empowered patient and confident decision-maker in your own care. Whether you're navigating a diagnosis or just want to get more out of your next doctor's visit, you'll want to listen to this episode.
Well, Holly, thank you so much for joining me today. Such an honor to have you on the Cancer Pod. When I was reviewing some of your bio for this, I know that you have a ton of media appearances on all sorts of shows. I was really impressed with that. But you're also a voiceover artist? What is that?
Yeah, it was funny. A friend of mine, because I do a lot of sort of videos for clients and such, and they're like, oh my God, you would be great. And so I'm like, what is voiceover acting? And then I got into it, went through all the courses. And yeah, it's basically, if you think about an actor on screen, listen, now that I say this, you will hear it all of the time. But on radio, on commercials, there are people that you don't hear or you don't see, but you're here talking. That's people like me, a voiceover actor. And we just voice over all of that content or that copy that you can't see. And so that's what that is.
That's what that's officially called. Okay, so Leah, who I do the podcast with, has also done that in the past, but I didn't know that that's what it was called.
Yeah, we're voiceover actresses.
Okay. All right. Well, now I know. That sounds like a lot of fun. Actually, as soon as I heard it, I think of cartoons.
Oh, well, I would love it. Well, there's whole, there are different genres, right? There's commercial, there's anime, there's all sorts of things that you can get into if you're interested. And cartoons is one of them. I actually took one of those classes and had a blast. I don't think I will continue on in that trajectory, but who knows?
Yeah, I think that's the direction I would go in because I would want to just under some goofy voices. Yeah.
Yep.
All right. So, well, the reason we invited you here was not to talk about voice acting, but one of your passions is helping your patients get the best medical treatments possible. And I know this. And that includes self-advocacy, navigating the systems that we have in place, no matter where you are. We have audiences around the world, but no matter what your system is in place, there is a level of self-advocacy that has to happen. And I kind of want to talk to you about that. Like, what do you see, at least in the United States, what are some of the hurdles to folks getting really good medicine and good medical care?
Yeah, it's a great question. And I think I'm going to back up. One of the things that I used to have a video. It's not on my website any further. I'm not sure where it is, so I should go look for it. But I loved it. It was like Dr. Holly's #1 health tip. And, you're thinking, what could this be? But it was a video for me advocating for people using I statements. Like instead of and I hear this all the time. He put me on this. And I say he, but it could be anything. Like she put me on this. She said, do this. It's basically this instructive from the medical team.
Mm-hmm.
And in my opinion, what's more powerful, because, I've always thought that there's a difference between compliance, right? Well, they said do this, and adherence. And adherence is think about it, adhere, like sticky. It's a healthy attachment, a faithful attachment to something. And in my opinion, the best thing for patients or consumers of medicine would be like, you know what? They said, here's what I should do based on whatever it is, imaging, my pathology, etc. You know what? Thank you so much. Smile and nod. I'm going to go home and think about it. And then I'm going to come back and say, I choose to do this. Now, why do I feel like that's important for people? I think it's important for people because it gives them a sense of power. And and on the contrary, it doesn't allow them to be a victim, right? So you can be either a victim or a creative cause. So let's be a creative cause in your life. And so I think from an oncology perspective, there are so many different opinions out there. And by all means, I do not want to disregard any opinion, whether it's standard of care, integrative, a second opinion from standard of care, but I want the person to feel empowered. So it's a scary diagnosis, as you well know, as I well know, being diagnosed with breast cancer myself. And so do we just march in line and go, oh, they said do this and that's what I'm going to do? Or can we open up our minds a little bit and say, this is what they said. I'm going to talk it over with my family. I'm going to talk it over with maybe a second opinion. I'm going to talk it over with an integrative, fab note like you are. And I want to come up with a plan that feels solid to me because in my opinion as well, that's where the strength is. It's not just that I followed this procedure or protocol. I followed my heart, my head, and what I felt really resonated with me. And that gives the power back to people.
So would that be akin to taking some authority in this position where it's a mutual decision making with your caregiver, whether it's a medical oncologist or surgical oncologist or whomever, where the patient feels at least in charge of the decisions rather than on the receiving end of the decisions? Is that what you mean?
Absolutely. I mean, 100%. I think that authority and, I always talk to my patients and I'm like, look, I'm your partner and you're the boss. And I say that and I mean it. I am their partner and they are the boss. And it's my job to give and impart. Docere means in Latin what? To teach, right? So I want to teach as much as I know about that individual case, about the individual recommendations of
Mhm.
standard of care. And I want to impart it in a way where those people then at consuming my care or the standard of care can put the dots really close together and then they connect them themselves and they make that informed decision and they have authority over what's next because I think that's where their power comes from and the authority, as you said, comes from.
So it's almost like it's literally an opinion, right? In medicine, you go to the doctor to get their opinion.
Mm.
Now, of course, the medical oncologist or surgical oncologist or radiation oncologist, whomever, has more expertise. So you give their opinion more weight than anyone else, perhaps. But this is where you get another opinion, perhaps a second opinion, somebody with equal caliber so that you can then have opinions coming in. And then what you're saying is line up the opinions, digest them, and say to yourself, I am going to make the conscious decision to go this and follow this one or that one or whatever.
Yeah, instead of just a streamlined fear-based
Yeah.
consent, I want it to be a more informed consent. And I think that comes with being able to pause and
Mhm.
being able to slow down a little bit and really take in all of the information. Because you and I probably well know when somebody gets a cancer diagnosis, everybody's weighing in. There's a lot of cooks in the kitchen.
Yes, there
And
is.
it can be overwhelming. And I think that those people need to be kind of weeded out at the same time. It's like if and look, everybody's different, right? Depends on how you grew up, how you
Mhm.
have been informed about how you can actually, have a voice.
Yeah.
There might be a situation where somebody just in their, you know, biography or biology didn't ever have a voice. And
Mhm.
maybe this is now a time where I can have a voice and I want to listen to everything everybody is saying. And I'm going to take that little sheet and go pros, cons, what have
Yeah.
you. But it's that person who is going to receive the treatment that gets to decide And I think it's a better outcome. This is just me, no evidence-based right here. This is just
Mhm.
me saying, I think it's a better outcome when somebody can own their decision because they know that's what they wanna do based on all of the information they got, and they're gonna say, "Yep, let's execute." And I think that's powerful.
Yeah, that's interesting because I think to myself, it's really a challenging time to become that if that's not who you are already. Now, may come as some surprise to you, Holly, but that's who I am already. I'm like, I'm like, wherever the situation is, I'm like, step aside, I'm taking over. So that's easy for me, but I do know people where that would be very challenging because that's not who they are. And so I hear what you're saying because some people maybe this is an opportunity to become more to have more self-agency in the moment. I would actually wonder if that is facilitated by bringing someone with you who allows you to be that. I have this thought where people are kind of what you expect them to be. So in a relationship, especially long-term relationships, whatever those two characters are in that relationship, that's who they bring in the room, and they're going to stick to that role a little bit. Where let's just say it's a man and a woman in a traditional relationship, and for whatever reason, you know, he's a dominant personality and she's not. If she goes in there with her best friend, it's a very different person than who just walked in the room than if she comes in with someone who maybe she has a dominating husband, right? So now I'm wondering, like, would that facilitate that to go with someone who actually helps you become more,
Yeah.
I don't know,
I
self.
mean, I think it's a great point, and it's also a great point not just for this scary diagnosis, but maybe for life in general. It's like, "You know what? Hun, I'm gonna have you stay home, and, I'll let you know how this goes." And you choose somebody who and I see this all the time in my practice as well, and I see that dynamic, with women who are going through breast cancer, and I don't wanna just say women go through breast cancer, I know men go through breast cancer
Yeah,
as well, so I wanna be very sensitive to that. Their husbands, in this case, are very, scared, and so they get dominant like, just, why can't you just do what they're saying?"
right.
And the women are taking a pause, you know there is I wanna there's actually research from, Polish medical centers in 2024 that found that cancer patients suppress their anxiety more than the general population, which I don't know in this day and age how that's possible, because there's a lot of anxiety right now. And those who control their emotions most tended to seek less emotional support and use more self-blame and denial. Like,
Mm,
this is coming out in the research. There's also from the American Institute for Cancer Research in 2018, they've been clear about this, calling it the tyranny of positivity when there's pressure to be ceaselessly positive, which
mhm,
can also be burdensome and I think invalidating. There's
right.
no right way to approach this whole diagnosis emotionally, but I think my point with you is that you said it best, the agency of having self control, and having agency over your body and what's going to be done to it based on all the options that are offered to you.
Yeah. Yeah, and you mentioned the word informed consent, and I would say that is another reason to slow down and to take your time and to listen to the medical team because as a patient, I think sometimes things are just done so quickly. I've had a lot of patients who after the fact, after treatment, they're like, "I didn't know that this and this could happen," or "I didn't realize that these side effects could be permanent," or whatever. So I think that it's really, to your point, really important to just take a moment, take a deep breath, make sure you digest everything. And literally, if you're not given the pros and cons, ask for them. Like what's temporary, what's permanent, what can be managed, what can I prevent, right? In our world of integrative oncology, we like to prevent the side effects of treatment, not
Yeah.
just treat them once they come. So yeah, it just kind of struck that chord to me of informed consent is not always so informative.
And no, it's not informative. It's actually you just signing the document that, hey, you know, this could happen if we do it. Um,
Yeah.
it's more like, let's get curious before critical. Let's get curious about,
Mhm.
can you talk to me a little bit more about that? And I think you bring up another great point. I know this is a diagnosis of immediacy, kind of,
Mhm.
right? For a lot of people. But I know it's counterintuitive, but it is also the time to slow down.
Mhm.
You gotta slow down. Like, you gotta think about what is your like, we talk about terrain medicine a lot, right? So terrain medicine, well, what is that? My best thing is like, okay, if you got a little goldfish swimming around in a dirty tank, are you gonna clean out the tank or are you gonna vaccinate the goldfish? You and I are gonna want to look at kind of
Mhm.
cleaning out that tank. Um, there's a lot of things that inform the cancer micro, environment, the tumor microenvironment. What's driving it? Let's talk about that more. Let's slow down and see. It's like, I mean, I can tell you with my own cancer diagnosis, oh my goodness, there were so many things out of balance that, as I know now, contributed, I
Mhm.
think, clearly, to this, my journey and to my diagnosis. And my ability to understand that and clean that up is huge because it's huge for healing and it's also huge for what do we worry about? So the number one risk factor for having cancer is what? Already having had cancer. It puts you in a
Mhm.
new risk category. And so it's to avoid recurrence and to
Mhm.
clean up that terrain or microenvironment that kind of contributed to why this happened in the first place. So,
And are you talking about physical terrain, mental, emotional, spiritual? What are we talking about? Or all of them? Bing, bing, bing.
bing, 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 you checked all the boxes, all of it. It's like there was the adverse childhood events that this work was done in the '70s, but I have to tell you that I think it's really important work that is showing that how you grew up as a kid, and if you could take this quiz, the adverse childhood events quiz, and if you score high on it, I can tell you with my population, on my roster at least,
Mhm.
people are scoring pretty high, and we have
Mhm.
to understand and unpack that a little bit. So, yeah. So
Yeah.
I think it's physical for sure, like, we have to think about our environment, think about what we've been exposed to. Emotional, we have to think about what we've been through, what we can process, what we don't process very well.
Mhm.
Spiritual, do we have a connection, outside of ourselves to something? All of that, I feel in my experience with working with people make a huge difference.
Yeah. Yeah, and you're still working with patients now, right? You're still
I
seeing
am.
patients?
I
Okay,
am.
thought so. Okay. Um, yeah, I mean, I think ingestion is a funny word, right? What we consume, what we ingest, and it's not just food.
Yeah.
So that
No.
I think
Yeah.
as people reflect on that, they can really be like, "Oh, that relationship or that person in my life," and, I've said this before on the podcast, there are people who are in relationships that they can't get out of, right? That's family. That's not good for them. So they have to find ways of managing that so that they can not take on the toxic aspects of
Yeah.
that relationship.
It's
Yeah.
interesting that you say that 'cause, my wife and I were having a conversation about this, the other day. When you feel, a connection with somebody outside of your family of origin or even extended family, and you're like, "You feel like family to me." I'm like, wait a minute. Should we reframe that a little bit? Because it's the family of origin or extended family that we're actually having issues with. So, I know how I know what it means, right? So you wanna say
Right.
it's like, "Oh my god, you feel like family." Like, I feel like I've known you for all my life. You feel like family to me.
Right.
But it's that one thing where I'm like, I think we should reframe that. Um, I feel like I've known you for a long time, or I feel like I've known you all my life. Let's just do that because it's interesting. And, I think that we do come through with contracts with our family and other people, and they're important. They're teachers, right?
Mhm.
Our family, our mom and dad. And again, can we be a victim or a creative cause?
Mhm.
Uh, we were dealt, across the board, the hand that we were dealt. How are we gonna play it, you know? Can we be like, "Whew, that was rough, and that sucked, and I wish I had something different, but this is what I've learned from it. This is how I'm gonna affect the world. This is how I'm gonna affect myself.
Mhm.
This is how I'm gonna grow and heal," and we get to be agencies of our own growth, and I think that's so important.
So what I hear you talking about is basically resilience is another topic we've touched on here, but, when you say that, would you call it a creative cause? Talk to you've used that phrase a couple times, and I've never heard the phrase creative cause. So,
Yeah.
what does
I
that mean exactly?
I
It's like
think that if you positioned against being a victim, right,
mhm,
or a creative cause, let me just throw out something. Like, let's say you were the child of 2 really abusive alcoholics.
okay.
You could easily fall into a victim category of that. Like, that is tough, right? Where people use substances to avoid their feelings or whatever they did and why they did it. But they were not emotionally or maybe physically available, or they were there, but they were abusive.
Mhm,
And I think as kids, I think kids are victims of that. But as we grow
sure.
older, okay, sure. Can we be a victim of that and live that out, or a creative cause? And the creative cause, what I mean by that, or at least what I think I mean by that is, can you use that into, you know, your superpower? Can it be good or evil?
Mhm,
And the good part is you you experienced it. You might see other people in the world that are experiencing it or had experienced it that you can identify with and maybe help, or you can help yourself as an adult going, "You know what? That was not a great hand that I was dealt, but guess what? I got an ace up my sleeve. That means I am going to get help where I need it, whether it's psychotherapy, whether it's somatic therapy like EMDR, brain spotting, etc. I have to heal from the wounds that, I was born into.
mhm.
And that is where I think a creative cause is. You get to be more creative in the cause that wounded you. And
Mhm.
you get then to not only heal yourself in a way, but you get to be a better healer in the world. And I think it all comes full circle.
Okay. Yeah. Yeah, I've got all sorts of analogies in my head, the phoenix that rises from the ashes or
Yes,
the
yes.
alchemist who takes base metals and makes gold or,
All of it.
like there's all sorts of ways of framing this, but I think I understand what you're saying now, which is
Yeah.
is 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 it's tough, but there are ways. You mentioned EMDR. What are some ways that you have found your patients use effectively to tap into this resilience that is there, but maybe it's not a, well-practiced muscle, so to speak. So, what are some of the ways in which your patients have found, a way
Yeah.
to that?
Th that's a great question, and I love that you use the muscle, uh analogy, or even the muscle term, because I think I would frame it as a gym, right? If we go to the gym and we push against resistance, right? What do? When you push against resistance, you break down things like muscle fibers in order to grow back stronger. Uh,
Mhm.
that's what weight training does. Any resistance training does. And I think from an emotional perspective, from a psychological perspective, from a spiritual perspective, when you go into that arena, whether and for anybody, I think it's different. Tina, you and I both know that, talk therapy is great for some people. More somatic, getting out of your frontal cortex and getting back into like your EMDR or brain spotting,
Mhm.
that could be effective for folks. You have to start somewhere. Just start talking it out. I think that's the best thing. But I do think that's the mental gym. You start
Mhm.
pushing against resistance for things that are really hard, but you break it down, because and then you grow back stronger. I was just talking to my friend today. I moved from LA, where I lived for 35 years. I've moved to this very small town, Santa Fe, New Mexico, which I adore and love, and it's beautiful. I know I don't live in LA anymore, but gosh darn it, I don't feel like I live here right now.
Mhm.
And when I was talking to her, I got teary a little bit, and but I think that was a good thing for me, just like,
Yeah.
I don't know where I'm at right now. And that's just the state of the union for me.
Right.
And that, uh, I didn't expect to cry. I just started to cry, and I was like, "Oh, this must be healthy." So
Yeah.
I had to
Yeah.
go with it.
Well, and, now that you say that, I mean, I think by and large, women have that at their disposal more than men. Men's relationships don't foster that type of intimacy and sharing. So this might be more challenging for for some people than others. If you have people you can talk to and you're talking honestly enough to get yourself to some place you didn't even know you were going to go
Yeah.
because you're having an honest heart to heart with someone. Um, it's quite a nice thing to have, right?
Mm,
Like I think that we all need that in our lives, and we need to foster those relationships so we can have those moments where
yeah.
who knew that that was going to
Well,
be.
and
Yeah.
I think men have that inside of them. Tina, this is funny, but I saw a meme today, or it might have been a reel, or I'm on social media like every seventh day for 7 seconds, I should say. But there was this man. He's like, "Yeah, I got some lesbian neighbors, and they got a son, and and this is exactly what he said. He was like, kind of worried about him, you know." He doesn't have a father figure, so he's not gonna know how to suppress emotions, he's not gonna know how to and he went on with all this disparaging things about men, and it was really funny, right?
Right.
But I think it brings to light, that, uh, I don't know, do we wanna go all the way back to John Gray and the book, Venus and Mars and women and men being different? I mean, we could, but I think it brings to light that, I think men have these emotions as well, and they have access to them. I still think in our society, we don't allow it enough, and,
Absolutely.
I think that's part of our responsibility is to let people talk and to be heard, men, women, whatever you, identify by.
Yeah. Yeah, I agree. I agree, and that's where the whether it is family or it's partners or it's friends, I think it's so important to keep our relationships strong for that
Yeah,
very reason.
very
Yeah.
much so.
So, let me ask you this. This is kind of an interesting question. In the grand scheme of mind-body medicine, and I've looked at a lot of the data on mind-body medicine, and some of it says like 90% of patients practice mind-body medicine, but generally speaking, there's do when they as soon as they put prayer on that list, it jacks it, right? So where does, like, formal prayer fit in this scheme of things? And I'm only saying this because I feel like this is something that nobody talks about. Like, in the data, like, are we talking meditation? Are we talking prayer? Are we saying going to church is therapeutic or going to synagogue? I don't know. Like, where does it fit in the mind-body picture in your mind? Like, is it separate from everything else we're talking about, or is it like, "Okay, that I already do that practice, I can just keep doing that?"
I Gosh, what a beautifully complex question for me, because I'm actually an agnostic person that prays,
Yeah.
you
Okay.
know?
Yeah.
And I think prayer fits beautifully for many people. Whether someone comes from a formal faith tradition or simply a deep personal spirituality, prayer can be a source of comfort, connection, surrender, and I think also hope. And
Mm.
I don't think we need to overcomplicate it for the most part. If it helps someone feel held, less alone and more grounded, that's meaningful. My grandmother, oh my gosh, she, on my dad's side, Bible thumper and mean and
Mean?
mean, so mean, like, like, s- uh, spank you with a butter stick mean, just,
Oh,
but very religious, and so there's a lot of, conflicting, um, messaging that I got from somebody who is so religious,
right.
right? But mean. And so and I think that's true for a lot of people that I've talked to on my roster. I call them roster because I think we're a team, my patients and such, and
Okay.
so um,
It sounds like a high school coach on my roster. I'm
on
like,
my
"Yeah, I got
roster.
now
No,
get it."
they're all on my roster. And so but I pray every day, I pray every night. And again, I'm fairly agnostic in my I remember going to college and going to every single, uh, I don't know, Buddhist, I was into Cat Stevens because 'cause I'm a musician, so at the time, I'm like, "What's his religion? I really would like to be Islamic." I learned about everything, right? And
Yeah.
so and I was great it was great for me, but at the end of the day, I was like, "I think there are commonalities in everything." And so I just wanna be a person that's thoughtful and that's grounded in wanting to learn about how other people feel about where they've come from. And, like I said, I lived in Los Angeles. Los Angeles, like the melting pot, there were so many different diversities there for 35 years. And it was such an education because I got to experience all of it. And so, to answer your question, I think prayer is really important, but it's so different for every single individual. How we
Yeah.
practice our medicine, right?
Right. I totally agree. It's an individual's choice, and what's good for one person may not work for another person. And I always say, when people get any diagnosis, no matter what the diagnosis is, if it's cancer or it's and whatever it is, if it's life altering, they bring themselves to the diagnosis. You know what I mean? You don't just become something after the diagnosis. Like suddenly I'm going to be a resilient person or whatever. Like you're still who you are. You still like we're all a work in progress, I guess, is kind of the take home there. And we're just
Very much so.
yeah.
Yes. And things that might have contributed or behaviors or patterns that might have contributed to the diagnosis and legitimately, like not just like woo woo, like legitimately, those sometimes after a bit of time can come back. And that's what I think is really important for people to understand is like, how can we shift this? You know, how can we shift that, that personal responsibility in a sense? And again, not being a victim, like this was done to you or you're
Right.
responsible for it, but can we empower people to say, look, you know, I've looked at everything and I feel like X, Y, and Z may be contributed to it. Um, if we could change this, we could have a better outcome for not having a reoccurrence and just being more resilient and
Mhm.
not just surviving, but thriving.
Yeah. Yeah, and when it comes to our relationships and those tough relationships that people have to deal with, and there's all sorts of different ones out there, whether it's from the past or present. Um, yeah, it's at once taking responsibility for your own action or reaction and not laying it on anyone else, but shifting it, because if you keep doing what you've always done, you're gonna keep getting what you've always gotten.
That is a great, like, do what you've always done, get what you always got. I mean, that's just a universal law. Like, you
Yeah,
can't, I don't think you can really, I don't think you can really argue with that.
right.
People like to,
Yeah.
but no,
Well, I know we'd like it to be different than that, but that is the truth of the matter. Yeah.
it's true.
And yeah, sometimes it's big changes people make. I had a patient who, had to quit her job in order for her to like have some peace. She's like, I gotta quit. I was like, you're gonna have to quit then. Like, I don't know. Don't tell. I mean, she knew the answer, and sure enough, she quit. And she felt so much better, but it was a big deal. I mean, she was a single mom, and she needed her job, and she's just like, she heard herself saying things like, "This job is killing me," and like she was so stressed out from that job. 'Cause I think the first 15 minutes of every visit was at least I spent on how the boss was, making her world miserable, and I'm just, you gotta make changes when you hear yourself continually coming back to some pain point or toxic ingestion, call
Yeah.
it,
Yeah.
you ask
Well,
yourself, "Can I get rid of it?"
that's an interesting thing. Like, just to hear somebody say, like, and we say it all the time casually, like, this job is killing me.
Yeah.
When you really back up and break that down, um, yeah.
Yeah,
And
you gotta hear yourself, right. You're like
always think in whole person care, which I think what at the end of the day we practice. I mean, there's all sorts of functional medicine and integrative medicine and holistic medicine and naturopathic medicine or whatever. But I think we're looking at the end of the day at people as whole people. And what is their relationship with their environment? What is their relationship with their selves? What is their relationship with their, food? I remember getting ready to give a talk, and I think I had to give the title of the talk, like, 6 months before the talk was ever due, and
yes,
that's
I hate
always
that. Yeah.
it's
I'm
always
not good at that.
yeah. So, I remember, like, throwing together something, and I was like, "Oh, what was I thinking?" And, diet happened to be in the, title, and I'm like,
Okay.
"I need to look up the word diet." Right? Novel.
Seems simple. Yeah, it should be self-explanatory, no?
No. Wait. I look up the word diet. What does diet mean? I mean, I was like blown away. It means habitual nourishment. how as a habit do you nourish yourself? And I was like, oh my gosh, this is a whole way of this is a whole different way of thinking about it. Because
Mhm.
nourishment means so many things. Diet means so many things, but nourishment is, I mean, and food in general can be like it is we want to use food as medicine, obviously, but food can be a drug. It's social, it's religious, it's celebratory, it's a lot.
Yeah.
And so it really helped me nuance how I started to talk to people in my practice about how they nourish themselves. Because sometimes people don't feel worthy of being nourished. And that, again,
Mm.
goes back to everything that we've been saying. And so, you know, what you and I do with integrative cancer journeys and people that are experiencing them, food and diet is a lot of it, right?
Yeah,
And
sure.
so that piece, that sliver of nourishment was so huge to me to be able
Yeah.
to break through and start talking about. So
Yeah.
that was like super interesting to me.
Yeah. Well, it's a good thing you committed to that 6 months ahead of time.
The idea that I thought I was gonna talk about was not the idea
Yeah.
that I
That
ended up
actually
talking about,
happened.
let's just say that, so, yeah, screw these people that ask for our slides and titles way too soon because the world is changing really, really quickly, and so are we.
Yeah. Yeah. I have scrapped entire lectures and redone them 3 days before an event. 'Cause, at that moment, it didn't feel fresh anymore.
Nope.
Like, how am I gonna give a lecture that's so stale? It's 3 months
Yeah,
ago.
3 months ago, 3 months ago.
Oh, well, I'm trying to think, is there anything else what do you these days, is there anything you had a podcast, do you still have a podcast?
I was called Mindful Medicine. I had so much fun. Alan Arkin was one of my favorite guests. Before he passed, I was able to interview him, and people don't know this about him, but he wrote, like, a lot of books.
Oh,
I don't wanna say the number because I think I will misquote myself and him. But, it was great, and it was really about trying to open up people's minds about medicine and all of the seductive messaging and from the medical establishment and also our industry as well, and just really start really talking about it. So, over 500 episodes, you can still find it on Radio MD.
oh,
So
mindful medicine.
Mindful medicine was great. We'll see what's gonna happen next, but at this point in time, I'm really wanting to be a helpful advocate and a good practitioner for folks that are experiencing this very scary I think it's a scary diagnosis. I think there's still a C word out there.
I
Um,
think so too.
yeah,
Mhm,
and
mhm.
help people slow down and make good decisions.
Yeah.
And know that, the terrain and the microenvironment and whatever is fueling that, it's almost like our immune system in general, right? So, one of the funniest things that I've ever heard from anybody is like, "Oh, my husband gave me a cold." And I'm like, "I don't think that's how it happens." It's like, you actually have an immune system that can and so it's really about that docere, in Latin, again, means to teach. And so, I don't think anybody can give you a cold. You can catch a cold because, well, we can go through that, as well. And hey, why does a cancering tumor happen? Can we
Mm.
talk about that and get into that a little bit more so we can understand what happened, care for you in an appropriate way, make informed decisions about your treatment, advocate for second opinions and integrative folks like you, myself, um, and then prevent reoccurrence in a system that has already proven to be cattywampus in the first
Mhm.
place.
Sure.
Because if it wasn't cattywampus in the first place, and by the way, cattywampus is a word that I adopted from our lovely friend, Dr. Tori Hudson. We were cutting down trees, and she's like, "Don't stack them so cattywampus." And I'm like, "What are you
What
talking
the
about,
heck is that? Yeah.
cattywampus?" But you can actually look it up. It does mean something, and I don't know how to spell it, but anyway. Um, but it's just doing that and helping people feel more confident and secure in their body.
Yeah. Well, this has been a fabulous chat, and I would love to have you back and talk more about other topics because it's just really an easy to talk with you, Holly. And
Yeah, it's my pleasure. Anytime. You let me know.
yeah. We live in parallel worlds out there in the naturopathic community. We seldom cross paths, but I hope that changes in the near future.
Yeah, thank you, Tina.
Thanks for listening to the Cancer Pod. Remember to subscribe, review, and rate us wherever you get your podcasts. Follow us on social media for updates. And as always, this is not medical advice. These are our opinions. Talk to your doctor before changing anything related to your treatment plan. The Cancer Pod is hosted by me, Dr. Leah Sherman, and by Dr. Tina Kaczor. Music is by Kevin MacLeod. See you next time.
Free audio post-production by alphonic.com.